During his sorry 20-year political career, Charlie Dent has repeatedly supported unconstitutional legislation that has created raging, out-of-control deficits. He also supports vast expansions of federal control over the people's health care, such as his support of S-CHIP, the Medical Rights Act of 2009, and now H.R. 5424 below, which is laughingly entitled as Reform Americans Can Afford Act. While it is constitutional for the state legislature of Pennsylvania to discuss health care options that work best for Pennsylvanians, the federal Congress has no constitutional authority to do so, and I have explained in detail why the current federal laws make health care both more expensive and lessen the quality of care in my health care plank. Therefore, I call upon Dent to sign discharge petition number 11 to bring about a House floor vote on the health care tax. Second, I call upon Dent to immediately cease his co-sponsorship of H.R. 5424, which replaces the $1 trillion tax by passing into law yet another 220-page boondoggle, H.R. 4038, which still attempts to, quote, establish universal access programs, unquote. H.R. 5424 usurps Pennsylvania's state sovereignty with the ridiculous use of taxpayer money to provide corrupt, donkey-eat-the-carrot state innovation programs. I call upon Dent to co-sponsor H.R. 4995, the End the Mandate Act, which restores the freedom of Americans to choose health insurance that best meets their individual needs by repealing the mandate that all Americans must obtain government-approved health care insurance or pay penalties. I call upon Dent to realize that while H.R. 4995, the End the Mandate Act, leaves most of the $1 trillion health care tax intact, it removes the mandate, which is the most objectionable portion of the bill, and has a chance of gaining enough House-wide support from Democrats and Republicans alike to be passed into law. It is a decent compromise, an unrecognizable term in D.C. these days, while H.R. 5424, which Dent has co-sponsored, has about as much chance of passing as a snowball does of surviving hell. Heritage Action for America has also called on Dent to sign discharge petition number 11. My other Republican challenger, John Callahan, supports the $1 trillion health care tax and probably just does not understand its economic impact, or else just blindly believes what his Washington handlers are telling him. It's impossible to find out, as this candidate has not actually campaigned for the past 12 months, since the start of his campaign. I challenge both Mr. Dent and Mr. Callahan to lengthy public debates on not just this important topic, but also the endless debt and endless wars. I offer to the public my constructive ideas to improve healthcare in my summary Healthcare Solutions and my healthcare plank, of both available online, and look forward to the public's feedback in the novel yet simple Our Open Office program. Speaking of a snowball's chance in hell, I also challenge both Dent and Callahan to never enroll in the overly lucrative congressional health care plans and donate $116,000 of their congressional salaries to local nonprofit hospitals to assist the needy, as I have pledged to do. I would like to add a special note to Mr. Dent and Mr. Callahan. Buy your health care on the marketplace just like everyone else. Because the last time I checked the Constitution, congressmen are not entitled to free health care, especially while they are destroying the country I love. And that goes for your Republican buddies as well. Sincerely, Jake Towne and the supporters of Towne for Congress.